So I had full body masculinizing surgery with Dr. Jesus Lego on the 5th of March. It was done in Madrid, Spain, and I was there for 2 weeks. And I got back the other day. It's currently the 21st of March, so it's just been over 2 weeks. The surgery involved a top surgery revision, body masculinizing lipo, which was like my hips, my stomach and my thighs to kind of make me a bit more rectangular rather than hourglassed. I also had a mons resection, and in total I have about 16 incisions from here to the top of my knees. Most of the incisions are like tiny little lipo holes, but some of them, like my mons scar, go from hip to hip. So I am very fragile right now. I just have like loads of notes down here because I can't remember everything, so if I'm like turning, that's why. A lot of people were asking questions about how much it cost if it was on the NHS, and I'll go through it all at the end. I went with this surgeon because a lot of my friends have had top surgery with him, and he also doesn't have a BMI limit. He just goes by informed consent. I have a couple other videos talking about my process and the meetings that I've had with him before surgery, and they'll be linked in the description if you're interested. So check those out if you want to know more. So we went to Spain, Madrid, on the 3rd of March, and then on the 4th I had my pre-op test, which was like an ECG blood test. But everything went well. I got the all okay, and we just went about our day, had a nice last day in Spain. My friend came with me and my mum came with me. They gave me the option to either stay in hospital the night before or come in at 7 AM, but I decided it would be better to like just go in before, just in case there was anything with traffic or any reason why we couldn't get there on time. So I stayed in hospital the night before. They gave me this cute little like goodie bag of like toothpaste and mouthwash and shower gel and stuff, and it was a cute room. I'm really glad that I stayed in the night before actually, and my mum stayed with me. There was like a sofa in the room as well that you could take the cushions off and sleep on. They also gave me this like food menu to fill out that was like what dietary requirements I had and what things I'd like for breakfast. Not the next day because I had to fast before surgery, but like dinner that day, and then the next morning because I was staying in hospital again, their breakfast, lunch and dinner. So we woke up at like 6:30 and the surgeon came in around 7:30. He drew all over me and like marked out what we were gonna do. I showed him some pictures of bodies that I was thinking of. I was really clear to be like, I like being bigger, but I just want my hips to be more rectangular. So I showed him pictures of people. After he drew on me, I made the payment and that went through fine. Surgery was at 8:30ish in the morning, and I got wheeled down to the room, got onto the bed, and the nurses were really sweet. Like, one had their arm on me and they gave me oxygen, and I didn't even count down. I was just like fell asleep straight away. They expected the surgery to take around 4 hours, but I woke up and was back in my room at 5:30 PM, so it took a lot longer than expected. I don't know if the surgery took longer or my recovery, like waking up, took longer than expected, but when I woke up I was kind of out of it and just shouting like help, and I was in a lot of pain. That was a bit distressing. I don't know if it was the medication of the anesthetic or if it was just the actual pain, but I don't remember it that clearly now. I was just like, help. A nurse came up to me and was like, sorry, we've given you the maximum amount of medication possible. And I was like, okay. And then I got wheeled up to my room where my mum was, and my friend and my brother came as well. I was not well. So I was really pale, really like tired and out of it.
Give me a wink.
I was nauseous and I was sick. I usually am sick after anesthetic I probably should have told them that beforehand, because as soon as I was sick, they gave me some anti-sickness on a drip. A nurse came up to me after I was being sick and like covered my face with some gauze and some really strong smelling thing, and I didn't know what she was trying to do, and I felt like I was being suffocated, and I was just like, what are you doing? What's going on? And she was just like, smell it. And then I wasn't sick again. They wanted me to try peeing, but usually after surgery I really struggled to. So after my hysterectomy a couple years ago, I had to be catheterized because I couldn't pee by myself. And this time was the same. So nurses came in and they were feeling my stomach to see if I really needed a wee or if I could wait a bit. And I don't think they knew that I had my big like scar across my stomach. So they were pressing that and they were like, is it painful? And I was like, yeah, but you're on my scar. And I don't know if they understood me. So that was also a bit like distressing. I was catheterized, which was fine. And then I peed a lot. So that was a relief. Then in the evening, I was able to get up, walk to the bathroom by myself. Because of everything feeling super tight, I couldn't like move much. So I was having a wee and the toilet roll was behind me, and I think I knocked it as I stood up, and after I peed the toilet roll, the whole new toilet roll fell into the toilet. So I said to my friend, like, can you get the nurses to help because I can't bend down? So they went out and they were like, I think they only knew the word for like help or emergency in Spanish. So the nurses came in like running, thinking that I had like fainted or something. And I was like, sorry, I've just dropped the toilet roll in the toilet, so they had to pick it up, and they're like, it's fine, don't worry. So that was fun, nice embarrassing moment for me. But yeah, everything was fine after that. I managed to have dinner. I was very like immobile. My friend had to like lift up a drink for me with a straw to drink it, and I just felt very like vulnerable and not great. My pain on the first day was probably an 8 out of 10, which is the most pain I've been in throughout all of my surgeries. So the next day the surgeon came in around 11 a.m. to just check over everything, tell me everything had gone fine. He discharged me and gave me some like pamphlets to go home with. My throat was starting to get quite sore from the tube that they put in, but that is normal for me. And my pain was about a 7 out of 10. We got a taxi home around 11, 12 maybe, and that was quite scary being in the taxi and having my seatbelt on. I just felt very like nervous and vulnerable, I guess. But I just got into bed. I didn't get any compression socks after this surgery, which was unusual for me, and I have some friends that are doctors that said I should definitely have them. So my friend went out to get some, and also I got prescribed tramadol because I was just on paracetamol and something else I can't remember the name of. I think the other thing is like more anti-inflammatory, but it might help with pain as well. But anyway, we managed to get a prescription or something higher, and I decided just to have it before bed because it can make you feel quite nauseous as well, and that helped me sleep through the night. On day 5, I managed to walk to a local shop, which was about 5 minutes away. I was very like nervous, still felt really tight, and I was a bit like shaky on my feet, but we went there, we went back, and it was nice to get some fresh air. My pain was about a 6 out of 10, then almost a week post-op. On day 9, my pain was about a 3 out of 10. On day 12, my pain was a 2 out of 10. On day 14, which was 2 weeks post-op, my pain was a 1 out of 10. I was told that I'd be in pain for about 10 days. And a lot of the pain that I feel is mostly like bruising and the tightness of the garment to reduce swelling is like rubbing on my leg hair, and that feels quite like itchy and uncomfortable. So it's not super painful. I just feel quite tight and like fragile. I do have some like really hard areas of swelling. It was on my armpits and on my lower stomach on one side, and then on my mons, which was not very pleasant, and it kind of made me a bit worried, but it's gone down a bit. I've been speaking to some friends who have had similar procedures with lipo, and they've said that that's really normal. and they suggested doing some lymphatic drainage massages. I feel like I didn't get the most like clear aftercare from the team itself. I don't think that's specific to this team. I think a lot of surgeons kind of just like assume that you know what to do, so they don't give you all the information. I don't know, it would have just been nice to have like a leaflet to be like, this is some things you can expect from it, just written down, because I feel like you're really nervous, fragile, feeling vulnerable after surgery anyway, so it would be nice to like lessen that panicking. I googled or searched on YouTube how to do those massages yourself, and I booked in a massage with The Real Massage, again my fave, in a week to kind of get that going, maybe reduce some pain, some bruising, some swelling. This might vary from surgeon to surgeon about their preferences, but I've heard that it's good to have a second garment that is even tighter than the first one as swelling goes down. So I have that coming on the way. I've noticed that there's some areas under my compression garment that are like not touching my body because I'm not as swollen, so I definitely feel like I need to be more compact. So I'm mostly feeling restless, bored, fragile, a bit lonely, because I had my friend with me for 2 weeks non-stop and they were so helpful, and now I'm just at home alone. And I'm also looking after my cat, and I just feel a bit worried that I can't do everything. Like, I can bend down, but it takes me a while and I'm not as like speedy, and I can't play with her as much as I'd like to. So yeah, I'm just feeling a bit like sorry for myself, but I know it'll pass. I'm also really nervous about my results. I had a look at my body like one day post-op. I just took the garment off to do a bit of like wet wiping down, and I took some pictures and I could already see a massive difference. But since then I've begun to swell and I feel a bit like dysphoric around my hips because I just feel like they're coming out a bit, and I don't know if that's just swelling or if it's like, I don't know, I just feel a bit nervous. But I have been told that swelling can take up to 3 months to like calm down and see your results, you know. But yeah, I feel mostly really good about the surgery. I can tell that there's a difference already. My chest feels a lot fuller than it did before, which is really nice. It was super concaved after my last surgery, and I had those like dog ear bits which have been filled out. I have this on right now because I have like a bit of dog earring and I'm trying to like compress the swelling, which was recommended by my surgeon. Yeah, that's everything so far. I'm 2 weeks post-op, like I said, and I'm just like taking it easy, just lying down basically. I have scheduled some friends to come over just to keep me company or like do some things that I find a bit difficult. I ordered a big food delivery. My brother came over the other day and helped me like pack it away and bring it upstairs, which was really nice. But I just got loads of like ready meals in, dried pasta and stuff, so I've not had to do like any cooking, which is really great. And before surgery I also meal prepped a bit and put it in the freezer, so thank you past self for doing that, because I appreciate it. I got my stitches out after about just under 2 weeks, and everything is healing up really well. Everything looks really like small and neat, but I know that it will probably widen as I heal, so I'm trying to be really careful not to lift my arms too much or not to like stretch my stomach too much, so I just need to be really careful with that. In terms of price, this was a private procedure. I don't think the NHS offer lipo for masculinizing surgery. I know they do offer chest revisions sometimes depending on what you need done, and they also offer Mons resection. The reason I went private was because I had some issues on the NHS, and also their BMI system just messed things up a bit. So the Mons resection was £1,500, the masculinizing lipo was £4,200, top surgery revision was £1,500, and they gave me a combined surgery discount of £650. The total of everything was £5,800. On top of that though, you've got to buy flights, 2 weeks accommodation, you have to stay in Spain for 2 weeks, transport to and from hospital, compression garments, which were expensive. These were about £100 each. I think it's easy to forget all the little things you need after surgery to help, and my advice would be plan everything out to the penny beforehand, so you're not like running out of money when you need it, if that makes sense. Maybe in total it's been about 7,000. I'm gonna keep documenting my progress and show you like before and afters and stuff, but right now there's not much to show because I am very swollen, so hope you understand. Okay, that's everything. Thanks for watching, I hope you're doing well, and I will speak to you soon. Bye.